Hello, everyone, and welcome. I'm Kevin Harker, the Executive Vice President for the American Heart Association's Midwest region, and I want to thank you for taking time out of your day to join us. I also want to express my sincerest gratitude to each of you for your relentless work, and also to congratulate you on your outstanding achievements in stroke care over the year. Today, you might be celebrating this award during your lunch break before you get back to the business of saving lives. Well, we know that some of your colleagues are not able to join today, so we are recording this program and we'll share the link so anyone who can't attend can watch it later. We'll be recognizing your awards with the scrolling video that you see on the screens now. Feel free to give shout outs, as I love what you're doing already in the chat box, to celebrate with your colleagues. And also be sure to share your thoughts on today's program on social media using the hashtag AHA Stroke Impact. And your public posts will appear on the live social media feed that you see on your screens as well. Well, let's keep things interactive today. I've seen a couple of chats over there. I've seen Kansas represented. That's where I'm coming to you from. I've seen Mid-Missouri. I've seen Nebraska. But right now in the chat, tell us where you're joining from today. And we'd love to hear from you from every state in the Midwest, every city in the Midwest as well. So let's see who's joining us today. All right, Milwaukee in the house, Grand Blanc, Michigan, love it. Bismarck, perfect. Kentucky, Rockford, love seeing that. Winfield, great. Great. Love seeing all of these many places that are throughout the, oh, there we go, Cincinnati, Ohio's here big time. Columbus, Western Kentucky, perfect. Well, you can see that we are very, very well represented from throughout the 13 states of the Midwest. So thank you again for joining. Well, during our time together this afternoon, you're going to hear from some of our extraordinary Midwest partners. You'll hear an update on our Mission Lifeline Stroke Nebraska project from Market Manager for Neuroscience with CHI Health in Nebraska. And I'll also have a conversation with Dr. Deepika Agarwal, a neurologist and a stroke survivor, who will share her incredible and inspiring story. But let's get our program started today with a very warm welcome from BJ Hicks. Dr. Hicks is the President-Elect of the Midwest Region Board of Directors and a vascular neurologist with Ohio Health Neurological Physicians, and he's the co-director of the Comprehensive Stroke Program at Ohio Health Riverside Methodist Hospital in Columbus, Ohio. Dr. Hicks?
Hello, I'm BJ Hicks, the President-Elect for the Midwest region of the American Heart and American Stroke Association. Now, it really is an honor recognizing the life-saving work done by many health professionals on this call today. Everyone's participation in our AHA quality programs and commitment to quality stroke care is truly saving lives and therefore improving outcomes for our stroke patients. Now, congratulations are in order to more than the 650 Midwest Get With the Guidelines stroke hospitals who have achieved stroke awards for consistently applying evidence-based care on the data reviewed for the 2020-2021 review cycle. One thing that's important to note is that 89% of our stroke patients discharged from the Midwest hospitals are covered with Get With the Guidelines. What does that mean? That's over 100,000 patients over the course of a calendar year. These awards represent your commitment to guideline-directed care for every eligible stroke patient, which ultimately saves lives and improves patient outcomes. Now, this year, we are thrilled to be able to gather together, some of you in person like I was, for the American Heart Association's International Stroke Conference in February. Hundreds of attendees from all around the world gathered for the first time since the 2020 session, and we gathered to hear the progress and the impact we're making in stroke care. Now, that includes advancements in our endovascular work and the early research on the impacts of COVID-19 on stroke risk. We also honored 12 leading stroke scientists for their exceptional achievements in stroke research. Now, personally, I had the opportunity during the stroke conference to meet with a group of HBCU pre-med students, that's historically Black college and university pre-med students, as well as pre-med students from Hispanic serving institutions around this country, which we hope will be our future students, our future medical students, and future physicians and researchers within cardiovascular and stroke work. I truly enjoyed every last moment with them, and it's truly something that I'll cherish, and I look forward to doing moving forward. We also learned about the work that's yet to be done. That's how structural racism, social determinants of health, impact risk factors and outcomes for our patients, the health inequities, the ills of society that we must address, and the issues that impact the quality of life for stroke survivors and their caregivers. For your connection with the AHA's Get With the Guidelines, your individual stroke teams are contributing to the knowledge and enhancement of stroke care. This means that 600 national research publications have been created stemming from Get With the Guidelines program data collected. Thank you for that. And on behalf of the AHA, a big resounding thank you for your resounding commitment to the communities that you serve and the patients that you treat. It is now my great pleasure to introduce our next speaker, someone who brings a tremendous impact to the commitment to quality of life for her health system. Pam Stout is the market manager for neuroscience for CHI Health in Nebraska. The 12 hospital CHI system in Nebraska participate in the Get With the Guidelines stroke programs, and Pam will share some highlights and an update on our mission, Lifeline Stroke Nebraska Project, which is wrapping up later this year. Welcome, Pam.
Can you take yourself off mute, please?
Well, that was fun, wasn't it? I've been talking. Okay, so Mission Lifeline Stroke Nebraska started in the summer of 2018. The grant was supported by the American Heart Association, American Stroke Association, and the Helmsley Charitable Trust, and works on the system of care. The system of care from EMS to rehabilitation and all the points in between. The Mission Lifeline Stroke Nebraska initiative brought key stakeholders across Nebraska together. And together we were able to address the needs of our rural state, including addressing disparities in educational needs. Coming together allowed for collaboration to improve our patient outcomes and our state's outcomes. We created task forces that worked on specific areas of care, such as EMS, where we brought EMS professionals together, from rehabilitation, where we looked at what services we have to offer and how we can get that information out, and that service is spread further. From clinical task force, where we really worked at developing plans for critical access hospitals, education, and then in 2017, so to give you an idea, in 2017 in Nebraska, we collected data on 1,825 stroke patients. Now in 2021, we are collecting more data. In 2021, we collected data on 4,591 patients. We went from 8 sites participating in Get With the Guidelines to 45 sites. Throughout this time, we've been working on our door-to-needle time. In Nebraska, our median door-to-needle time in 2021 was just 43 minutes. Mission Lifeline Stroke Nebraska provided education to healthcare professionals from EMS, hospital nurses, physicians, techs, to rehab professionals through both in-person and virtual events. We're excited that we're going to kind of wrap this up next week, actually, with a stroke symposium that I believe we have over 600 people registered for right now. Kind of shifting gears and talking a little bit more about the impact that Mission Lifeline Stroke has had on Nebraska's CHI health system. This gave us the ability to bring all of our hospitals, including our critical access hospitals, onto the Get With the Guideline data platform. That includes 8 certified stroke centers and 5 critical access hospitals. The benefit of this is the ability to look at our data on a system level and look for opportunities that can be addressed from a system perspective to improve our patient outcomes. CHI Nebraska median door-to-needle time has gone from 51 minutes in 2017 to just 41 minutes in 2021. We have been able to be a leader in the state in the education that's being provided and in impacting care throughout our state. And we are very, very proud of all of our certified centers that are earning awards this year.
Hey, thank you so much, Pam. That was great. I'm so glad that we were able to hear you as well. It really got great then too. So thank you all for your patience with regard to this. And Pam, thank you so much. As you shared, Mission Lifeline is the American Heart Association's community-based initiative to develop systems of care to improve outcomes for heart attack and stroke patients. And as Pam mentioned, 2 of our Midwest states, North Dakota and Nebraska, have been the beneficiary of very, very generous funding from the Leona M. and Harry B. Helmsley Charitable Trust for our Mission Lifeline stroke projects in those states. We are truly grateful for the generosity of the Helmsley Charitable Trust, as Pam mentioned, for their support of this life-saving and very, very important work across the Midwest. Thank you, Pam. Great to see you. All right. Now, as you know, nothing brings the importance of our work to life like the inspirational stories that we hear from individuals who have been impacted by stroke. And so I am so honored this afternoon to introduce you to Dr. Deepika Agarwal. She's a neurologist who knows a lot about treating a stroke, and then she had the unthinkable. She had the stroke herself. Dr. Agarwal is going to walk through her story of survival with us today. Deepika?
Thank you, Kevin.
Yes, well, thank you so much for being here, and it's great to see you again. We were able to chat last week where I first met you, and I'll tell you, Deepika, your story touched my heart, but also it was such an incredible story, and I know that all of the individuals that are joining us here today will really be blessed by hearing your story and what you have to share, and both kind of linking that as a neurologist, but also as a stroke survivor. And so I wondered if you could take us through those moments when you were sitting there enjoying breakfast that day and kind of tell us what happened, if you will.
Yes. So, Kevin, call it irony or destiny. So just like, being a neurologist and a stroke survivor, it has been I don't know. I mean, seriously, I mean, maybe just destiny. So, I mean, and as I mentioned to you earlier, that the day I had the stroke, I was off that day. It was weekday. I was off, and so I just decided to pamper myself. So went to a restaurant here for brunch, and while sitting there, now I had textbook, what you described in the textbook case of thunderclap headache. I mean, I should have known that it is a thunderclap headache and I should call 911 or do something about it. But I thought that, nah, it's just a bad, severe migraine. But at least the good thing what I did was I called or I texted a colleague and I told her that I'm at this particular restaurant and I'm having severe migraine. And in fact, she offered that, do you want a ride? I can come and get you, or go to the ER, or do you want me to drive you to the ER? Because I was pretty close to the hospital.
Mm-hmm.
And I was like, no, I am neuro intact. I'm still talking in neurology terms that my NIH stroke scale is 0. I'm neuro intact. I don't think so. I need to go to the ER. I'm fine. Just probably it's just a bad migraine, and I'll check out from the restaurant. I don't want to throw up in front of people and ruin their breakfast, and I'll go and sit in my car. And she said, that's okay. It's a good idea, and I'll check on you in 15 minutes. And probably, I think in the next 15 minutes when she called me, I did not answer. And then by the time I answered my phone, my speech was garbled. I don't remember any of those. And so, of course, I mean, she drove to the restaurant, to the parking lot, found my car. And then when she saw me, my colleague, my friend, she's also a neurologist. So I had facial droop and I was slurring my speech and I was not responsive. I was pretty much, I mean, the textbook features of aphasia.
Right, right. Well, and we talk a lot about, at the Heart Association, we talk a lot about FAST. Those are the warning signs of, to knowing if somebody has a stroke, and it was that facial drooping, that as you mentioned, the arm maybe weakness, which I know you'll talk about then too. The S is speech, which you mentioned, and then T is time. And luckily, and you were so fortunate to have an amazing friend and colleague who was like with you and who kind of knew something didn't sound right, but you were able to get to, she was able to come, and that chain of survival was there. Each step in the chain of survival of knowing that you were having a stroke, that recognition that something was wrong, having your friend then being there and calling 911 and knowing, when that last known well time period was, everything worked. That chain of survival was in process for that then too. So, can you talk a little bit more about that? Because it was just a 2-hour time period, wasn't it? From the time that you actually had the first symptoms to actually being in surgery, correct?
So not being in surgery. So by the time I was in the ER.
In the ER. Thank you. Thank you for that. Yeah.
So 11 o'clock, my headache started in the morning. And then by 1 o'clock, I was in the ER. I got the CT scan also. So yes, I mean, it just took 2 hours for someone. I mean, and I was alone in the restaurant. So, I mean, yes, time is brain. So by 2 hours, my CT scan was up, and my colleagues in the hospital, they knew that I have a subarachnoid hemorrhage, and then they were preparing for intervention radiology to do an angiogram and coiling, and then that was unsuccessful. So then they took me to surgery. So I was in the OR by about 5 o'clock. I was getting a craniotomy and my brain was open basically by 5 p.m.
Wow. You talked when we talked last week. You shared a lot about the challenges that you went through during the recovery process, and all the different rehabilitation work that you have been on. Do you mind kind of walking us through that, because you have been on a journey, Deepika? And so, can you share with us a little bit about that journey?
Yes, sure. And in fact, the journey is not over yet.
Right, right.
I mean, I am 2.5 years post stroke now, and I'm still doing therapies. So one thing which I would like to spread awareness about is that stroke recovery, it comes with no expiration date. I mean, you just need to keep on doing the recovery. So like about 5 to 10 years ago, we used to tell patients, in fact, even I learned in residency that the stroke recovery, it happens for 6 months to a year after the stroke, and after that, the recovery kind of plateaus. No, that is not true now. I mean, currently research has shown that the brain keeps adapting. That's what neuroplasticity is. So yes, I mean, keep on doing therapies. Repetition is the key. So yes, I mean, I was completely weak, or paralyzed on my right side, right upper and lower extremity. I was completely aphasic, was not able to talk. Memory was impacted. Right now, I can run on the treadmill. I'm still learning to use my right upper extremity. It's not functional, but I'm still doing therapies. You can hear my speech. I'm back to work. I mean, I'm back to seeing patients in the clinic. So, I mean, all this goes to therapy. I mean,
Right, right.
so yeah, continuous therapy.
Deepika, one of the things that you mentioned as well, just having to do things with your left hand, like, and you mentioned things that we all, putting on makeup or doing your hair, those types of things then too. Can you talk a little bit about that from your journey?
Yes, so definitely. I mean, it's not easy to relearn everything from your left hand. So, I mean, and simple things like, okay, I mean, just things like, yes, putting on the makeup, but to serious stuff like signing a check.
Right, right.
Or signing a paper prescription. I mean, this is the work, I mean, we still have to do. So yes, I mean, you have to learn writing. And then, I mean, I learned driving. I mean, I'm driving using my left hand only. So everything, I mean, it's a constant journey, repetition. Again, just like just like a kid. I mean, you have to retrain, you have to relearn things. It is possible.
Yeah. Yeah, I love when we talked, and then you mentioned it a couple of times, just that repetition that you have to do to kind of retrain your brain then too. So, Deepika, your recovery is remarkable. You think about where you've come in the last 2.5 years. Thinking about where you are today, I'm sure that when you said you're back to work, I'm sure that putting on that white doctor's coat after 2 years was a really, emotional experience for you. How has your stroke changed you as a neurologist? Do you think it's made you a different doctor?
Yes, definitely. So, I mean, I think now, so, I mean, I knew about stroke earlier, but my knowledge was bookish. I mean, what books teaches every person or doctor or neurologist. But now I'm living with a stroke. So whatever, I mean, the patients are experiencing, I have already experienced that, or I am experiencing those. So just, I mean, I can just understand, I can connect with them better. And I mean, they also value my suggestion, my advice better because, I mean, there is some component of personal experience with this. So definitely, I mean, it has definitely, I would say, made me a better neurologist because not only I can connect with the patients medically as a doctor-physician relationship, but as more of as a survivor.
That's wonderful. That's wonderful. I've got another question for you as well, then, Deepika. Do you have any advice to the physicians that are working with the neurologists, the physicians, the nurses that are working with stroke survivors? You mentioned you're living with a stroke. I mean, you're thriving after your stroke. But do you have any advice for those individuals that maybe of encouragement for those individuals that have been faced a stroke and are still thriving?
Well, I mean, just keep fighting. Do
Keep fighting.
not lose hope. Just keep fighting. I mean, again, repetition is the key. And the recovery, it's not something that's going to happen in a year or two. It can take years. It can be for God knows. I mean, in my case, I don't know. It's probably going to take at least few more years. I mean, but yes. So just keep fighting. And then, of course, the other big thing is do not ignore your mental health. I mean, the recovery
That's
is,
great advice.
yes, I mean, it is a strenuous process. I mean, the recovery is hard for the mind.
Right.
And as it is, stroke affects the brain. So, and then of course, I mean, it changes your life completely. So yes,
Absolutely.
I mean, give your mental health the same importance as your physical health. So that's another thing. I mean, it's a great, point again. I want people to be aware of that. Don't ignore your mental health, and if you need mental health, please ask for help.
Right. Well, good advice. And thank you, Deepika, for sharing your story with all of us. That takes a lot of courage. And so thank you for inspiring us. And we want to check back in with you sometime about your health journey. And we will be sending thoughts and prayers to you your way that you continue to make such amazing progress. So great job. And thank you for joining us today. You're very, very welcome. So many of the individuals joining us today work with stroke survivors every day, but your unique experience on both sides of the stroke as a neurologist and as a stroke survivor, Deepika, that's what gives you such valuable insights. So thank you so much. We've also put a detailed version of Deepika's story in the chat box. So if you have time after today's program, if you'd like to hear more about that, I know that you'll be blessed to check that out. So thank you so much. Well, I'll tell you, we have reached the end of our time together today. And as I close this celebration, I just want to reiterate my congratulations to each of you in your incredible, incredible work, and to express my gratitude on behalf of everyone in the Midwest region. I've loved being able to see each of your hospitals scrolling and the impact that each of you have made. You truly have been a relentless force as we focus on saving lives and changing lives through the American Heart Association. We know that every day there are amazing stories of passionate teamwork, examples of overcoming challenges, and leveraging the expertise and talents that you bring to this work to touch people's lives. This year, beyond today's celebration, we want to lift up all of your stories to share throughout the National Stroke Month. And so we'd love to hear, certainly, your stories. To do this, we invite you to share your stories to our AHA There we go. To our AHA Stroke Impact, hashtag AHA Stroke Impact, by posting pictures of your team, your award, and your messages about how your team is impacting stroke care and patient lives in your community. Your photos and stories will continue to live on our heart.org website following the event through the end of National Stroke Month in May. So we want to see those stories. Additionally, we look forward to announcing the upcoming 2022 awards in early summer as the 2021 data is finalized. If you qualify for a 2022 award, you've earned it. So go ahead and flaunt it, folks. This year's award toolkits include a few new items that you can use to help promote your hospital's award, including examples of pull-up banners, in-hospital customizable videos, as well as ads and other materials that your hospitals can share your accomplishments. So thank you again to Dr. BJ Hicks, to Pam Stout, to Dr. Deepika Agarwal for joining us today and for helping us truly bring this program to you. Thank you all, and thank you for helping us change lives and save lives. Thank you all.